Thursday night webinar with our doctor's testimonial night for Nyloxin. My name is Steve Gawecki. I'm the president of Nyloxin. Very excited that you're here tonight as we have lined up a very special lineup of guest speakers of people that are professionals in the medical community representing different disciplines in the medical field. And you're going to be hearing a little bit from all of them this evening. But our primary speaker and guest speaker tonight to get us started is the CEO of Nutrapharma Corporation, which is the parent company and the company that has created our Nyloxin pain relief product, represented by the CEO, Mr. Rik Deitsch. And I want to give a proper background for Rik. Rik has been the CEO of Nutrapharma for over 10 years. He is the person, again, that created Nyloxin and the pain relief product. He's a biochemist, a chief product formulator. He's developed over, many products, top-selling products in the direct selling industry for over the last 25 years. Many of his products have done well over $100 million in sales. So Rik is no stranger to success in developing successful products for the direct selling industry. He also is an author of a few different books. His last book, Invisible Killers, is available on Amazon. He lectures and speaks all over the country for biosciences and so forth. In fact, let me just flip over here real quick here. And again, he is the formulator of our Nyloxin product, originally under the brand of Cobroxin here a few years back. So, Rik, very excited to have you on the call tonight. Thanks for being here. We'd love to hear from you on your thoughts on Nyloxin and performance the last quarter, just observations from Houston. And I know you want to talk about this very exciting panel of doctors that we have on tonight in the upcoming formulation of the medical advisory team. So, Rik Deitsch, everybody, take it away, Rik.
For having me. It's always a pleasure. As Steve just said, I am a biochemist. I like to say I'm a little different in the field because I'm both a nutritional biochemist and a pharmaceutical biochemist. So I've worked in the world of drugs with the FDA, and I've worked with dietary supplements on the front lines with several different network marketing companies and with all the divisions of the Rexall Sundown Company, and that included Royal Numico, Worldwide Pure Protein, Metrex, GNC, and more. When I was at Rexall, we were really very pleased that about 30% of our distributor force were medical professionals. These are people that did their due diligence on our products and understood the valid nature of those products, the mechanism of action, the clinical research behind them. And so I'm thrilled to report that we are moving forward with putting together a third-party medical advisory board. And this is important to understand. These are third-party physicians, medical professionals that are doing their own due diligence, their own research on the products that we're going to bring to market, starting with, first and foremost, of course, Nyloxin. Now, as many of you know, that the research behind Nyloxin is supported by 46 published human clinical studies, not to mention the preclinical and animal studies that we conducted in-house for the product. The last study that we conducted and published was a rat model that went against morphine. And we showed that Nyloxin, longer than morphine, 4 to 6 hours longer than morphine, and on a month-there basis, because it's so much more potent than morphine, a small infinitesimal dose compared to what you take in morphine, it's actually 600 times more potent than morphine. And very exciting stuff. We're going to continue to do clinical research on the Nyloxin, and now we're excited to launch Pet Pain Away, the Nyloxin version for dogs and cats, for companion animals. We announced it over the weekend in the meeting in Houston, and everybody was incredibly excited. So you're going to see more and more information on the Pet Pain Away coming up. But let's understand what it means to have a third-party medical advisory board. Not only will these physicians be doing their own due diligence, but they're going to be asking the tough questions. We need to be able to put a chip on our shoulder. We need to be able to tell people that we have a product that works, and we're going to have additional products that work, that stand the test of time and stand scrutiny. If we can't do that, we have no business having those products out there. And I say that very clearly because there are lots and lots of companies that have products that either don't work or they're just simply generic. I've seen companies launch. In fact, I just heard of a company today announce that they were launching. I saw the 3 products they're launching with, and they were incredibly generic formulas, stuff that you could pretty much buy at Walmart for a few dollars, and they're going to launch an entire network marketing company against that. There is nothing on the market like Nyloxin. It is completely unique, protected by a patent, a Nutripharma's patent, and it's a product that absolutely works, replaces very incredibly strong pain drugs that in this case is non-narcotic, non-addictive, non-opiate, no NSAIDs, no acetaminophen, no Tylenol. It's a completely different product, and we know it works and it's effective. And so, too, with the pet pain away. And any other products we bring to this marketing group, they're going to be unique. They're going to be different. They're going to be disruptive. And we love the fact that we have this medical advisory board coming on that's going to ensure that. It's going to ask the tough questions, going to provide the frequently asked questions. And as we expand and we start doing regional meetings and national meetings, we'll have these people continue to lecture and educate the distributor force. We're just getting this started. So as we put this together, you're going to hear the name Medvisory. And Medvisory, those are the doctors, those are the physicians, the medical professionals. They're going to be behind the scenes putting this together, supporting our efforts. And again, remember, these are third party, which means that every once in a while they're not going to agree with me. They're not going to agree with us. And I love that. I love when people ask me the questions and force me to come up with the answers. And sometimes we have to look for it. We have to do the clinical research. We have to dig. We have to make sure that we know what we're talking about. We should be bulletproof. And if we're not, we're doing something wrong. And so I hope people understand that. I never say trust me or believe what I say. I say do your due diligence. Look at the research I'm talking about. It's all available on our website, and it's available in our literature. And it's available to yourself when you become a product of the product. When I was in Houston over the weekend, I couldn't believe the testimonials of people coming up and telling me how Nyloxin had changed their lives. I've seen it for myself. I'm a product user as well. I've told many of you that I was in a car accident back in 1997. I have a syringomyelia, a syrinx in my back. I've had chronic back pain since 1997. I use Nyloxin all the time. To me, it's a life-changing product. And now it's become a life-changing product for so many of you. And with pet pain away, we've already seen it in effect in dogs and cats. They love it. They love the product. And we see almost instant, amazing results. And you guys are going to see that as well as the product rolls out. So, Steve, I can't tell you how excited I am right today and for the future of the company. I'm excited for the meetings coming up. I know we've already announced Sacramento, but there's a lot of exciting things happening in the months to come.
Fantastic. And Rik, I thank you for coming out and getting us started here tonight in this doctor's testimonial call. And ladies and gentlemen, if you didn't get a chance to see Rik in Houston live, I really, really recommend you get your ticket lined up for Sacramento, as Rik will plan on being there to speak as well. And he's just a dynamic individual and speaker and has tremendous information. Rik, is there anything else that you might want to add on about, how does this advisory team in the end, how is it going to be good for the MIEs listening to the webinar tonight?
Well, as I said, all of us, as we move forward, are going to have our doubts. We're going to have, I was told years ago that every one of us has a belief bucket, and the belief bucket always needs to be filled up. And the problem is our belief bucket has holes. So we're always losing belief. And especially when you bump into someone and there's Cobra Vet, snake oil, you're a snake oil salesman, and you take a little ding. And you know that the product works, but now they called you a snake oil salesman. So you got to back up and say, it's not snake oil, it's snake venom. It's supported by 46 published clinical studies. Someone might say it's an MLM or certain people are involved. You got to take a step back and say, who's involved? Well, we have these world-class, prolific writers, these amazing medical professionals that have looked at this, done their due diligence, and said, you know what, this stuff is good. It's good stuff. It's supported by the research. The mechanisms of actions make sense. This is something people should be using. And as we start to get that sense of posture, because we believe in ourselves, believe in the company, believe in the product, we're going to be able to share this with more and more people, with our family, our friends, people we know, love, and trust, are going to continue to know, love, and trust us and use the product. And that's where these medical professionals come in. They're going to allow us to be bulletproof, as I said before. They're going to give us the satisfaction that we're doing the right thing and sharing this product with others. I can't tell you, a lot of network marketers might be on the phone today, but I've seen so many network marketing companies where they didn't even care about the product. It was all about the opportunity. And in this case, we can be really proud that we have disruptive products, these products that are going to change lives. And having this medical advisory board, this unimpeachable medical advisory board, is going to make all the difference. We're going to be able to see that they are prolific. They're going to be able to write articles for us, publish that. We're going to have a website separate for them. Right now, I can't go into all the details because we're still in the process of writing the charter for the board. But as we get that charter up and we flesh out who's going to be doing what, you're going to see that there's going to be so much information coming from the medical professionals and provided to the distributors on calls like this, in live meetings, on webinars. We're going to have access to some world-class medical professionals that are going to make the difference for us in prospecting and education and in just learning about the products and the products to come.
Now, Rick, as I understand, there's also going to be in the near future a medical kit, promotional kit that MIEs will be able to use to properly introduce the business to people in the medical field. Is that correct? No, I couldn't hear you. Yeah, the question was again about the production of a medical package or kit as a way of introducing Nyloxin properly to medical professionals. Is that something that we're in development on, and how soon might we expect to see something?
Well, first, I want to be clear that so many distributors want to go to their physician and tell their physician what a great product Nyloxin is and that they should use it for their patients. And you've got to be careful. You can never tell a doctor how to treat their patients. I always warn people about that. If you go to a doctor, don't say, here's a product you need to use in your patient population, because they just won't listen to you. It's not your job to tell a doctor how to treat their patients. I would advise that everyone treat doctors just like people, because guess what? Doctors are people too. And most of them have chronic pain issues, if not for themselves, then for their family, their friends, people they know or love. And what you do is introduce Nyloxin to a physician the same way you'd introduce it to anybody else. Here's a product that might help you with your pain, or your wife, or your children, or your pets with pet pain away. And as a physician does their due diligence, they're naturally going to see this is something that's not just going to benefit them, but is going to benefit their patient population. A doctor has a sacred trust to do what's best for their patient. Once they understand how great the product is, they're going to introduce this and use it in the patient population. But you can't tell them to do that right away. Now, all that being said, we're trying to make tools that are going to be easier for physicians to introduce the product to the patient population. We're working on a display for the 8-ounce pump that could go right in a waiting room. In other words, try me. Allow the patients, while they're in the waiting room, to try the Nyloxin. So the 8-ounce pump will be right out front. It'll be the brochures available to them, and they'll say, ask your doctor about Nyloxin. And when they go in, they can ask the physician about it. We're creating some materials for physicians to educate physicians, and we're creating materials specifically for doctors' offices to introduce the product to the patient population. So all this should be done by, if not the end of this year, early next year. It's going to be easier and easier for medical professionals, not just physicians, but chiropractors, physical therapists, personal trainers, to be able to introduce this product into their populations.
Perfect. Thank you, Rick, for your time this evening. We appreciate it very much, and for kicking us off on our doctor's testimonial webinar tonight. Thank you. All right. Well, ladies and gentlemen, our next scheduled guest speaker tonight was Dr. David Talbot, who is with MedVadvisory Consulting Network. And Dr. Talbot had a last-minute conflict that didn't allow him to be with us as a guest tonight. But he did ask me if I could share a little bit about, his involvement in Nyloxin, his testimonial. So I'm going to just briefly touch on his background here for that purpose, and then we're going to move on to our next guest speaker. But we have a gentleman by the name of Dr. David Talbot, who was involved with Nyloxin, and his background briefly is that he went to medical school in Great Britain and also in the Caribbean, where he got his medical study, and then he later got more involved in the marketing side of the medical industry and became a regional director of a $400 million company. He has done work and research on D-amino acid and biofilm, but he is one of the founders of the MedVadvisory Consulting Network, which is the marketing consulting company to medical professionals, which will not only be reviewing able to provide reviews to an advisory network, but also a referral site for other health professionals to easily communicate with consultants, review scientific and medical research, review case studies, and much more. And I didn't have enough information to put everything on his notes, so I'm going to just read off what the rest of his information says here. It says the MedVisory website is presently being blueprinted and MedVisory projects having over 50 health professionals on board with the projection of having several hundred or more later on. Companies like products like Nutrapharm and Nyloxin are companies that MedVisory will be recommending and participating with, and it's a part of what Rik has been talking about here as far as the advisory network and advisory board. Dr. David Talbot is involved in this process, and he will be here the next time to speak for himself. But I just wanted to share that he's involved. This is one of the individuals in the process of working with Rik Deitsch in forming this advisory network. Okay, let's move on to our next guest tonight. We want to go ahead and invite on the call tonight Dr. Bill Richardson. A little background about Dr. Richardson. Again, you're seeing abbreviated, man. I tell you, if I would put their resume on here, it would be pages and pages long. These gentlemen have extensive backgrounds in what they do in their education and their training. So it's very much abbreviated, and that's why it says abbreviated. But he started back in 1976 with his bachelor's in zoology, which I found interesting. His master's degree was in biology, and his doctorate degree is in osteopathy in 1981. Did his residency at the Detroit Osteopathic Hospital. He is currently physician owner of Keys Cardiology, and he is affiliated to Lehigh Regional Medical Center. Dr. Bill Richardson, are you on the line? Fine. Dr. Richardson, I understand that here last weekend
Wonderful.
that you were involved in a doctor's conference in Fort Myers, and I know that you'll be sharing your thoughts about our company in Nyloxin, but please be sure to add your comments about that experience in that doctor's conference and what you learned from that about the reaction from other doctors and physicians that you met as you talked about our company and our product at that event as well. So the microphone is yours. Thank you for being one of our guests tonight, and share as you will.
Yeah, okay. I hope I don't lose you. Just very briefly, a good friend of mine, Dr. Victor Genchi, was there at the conference, and actually I informed him about it, and he put on the presentation. I spent a lot of time in the conference and then talking to people outside of I've used the product myself on my patients, and I would say 80% of the patients that come in my office that have chronic myalgias, neuralgias, diabetic neuropathy, find relief within about 10 to 15 minutes. I put it on as soon as they come in the office. I ask them if they have aches and pains, and it goes away. It's absolutely amazing. It doesn't work very well on typical, bone-on-bone, bad end-stage arthritic knee conditions, things like that. But it's very good for classic strain sprains, fibromyalgia, and such illnesses.
Okay, and Dr. Richardson, could you maybe just share a little bit about your experience at the Fort Myers Doctors Conference, and what did you learn from that, event about the interest in our product, and how well was Nyloxin received when you introduced it to some of the other doctors that were attending that event?
It was very well received. Dr. Genchi headed the presentation, and patients and doctors were very, very amazed at the results they were getting. They would literally get relief within 5 to 10 minutes.
Wow. So where do you see Nyloxin going in the medical field as far as its acceptance and use with other doctors in various disciplines and hospitals? I mean, what do you think the future is, in your opinion, for Nyloxin?
I think it's very useful for pain physicians. And I respect what the other gentleman said. We can't preach to other physicians. We can just advise and give them a little sample. I carry around a little squeeze bottle with me. I find that the gel works most rapidly for those with fibromyalgia or chronic pain syndromes. The spray is very good, but it takes about a day or two to really kick in. But physicians are open, but they have a healthy skepticism. So leaving them sometimes with a bottle, or at least just putting it on their own aches and pains, is very helpful. Now, one doctor I stopped by, a foot doctor, had a patient in his office. He said, "You know what? A family doctor just put some cream on my patient's foot, and it went away." I said, "Was it Nyloxin?" He said, "Yes." Well, I happened to have given a bottle to another doctor, and he was using it. He hasn't signed up yet, but at least he's using it. So it's very effective, and it's a wonderful product.
Awesome. Well, we're very excited to have you on board with Nyloxin, and thank you for joining us as a guest on our testimonial call tonight. And we look forward to meeting in person with you someday soon. All right, next, just a moment, let's move on here to Dr. Victor Genchi. Dr. Victor Genchi, are you with us? Genchi, are you with us?
Okay, is that good?
If you're speaking, we're not hearing you. You may have to I hear a little feedback.
Okay, how about now?
Okay, yes, sir. Let me go ahead and if you can mute your button for 1 second, I'll give you an introduction here properly. And now that I know that you can get on the microphone, so you go ahead and get to your. Now, ladies and gentlemen, I want you to meet Dr. Victor Genchi. He's a DDS dentist practicing internal medicine in Palm Beach County, Florida. Very interesting background. He's also certified in acupuncture, and he's a definite promoter of natural control for pain and discomfort and natural healing methods. So I'm sure, Dr. Genchi, when you saw Nyloxin, it must have been a good fit for you. But tell us about your experience with the product, both personally and also for people that you've recommended it to in your practice. And I would love to hear your feedback on reactions from the medical conference that you attended with Dr. Richardson here in Fort Myers. Tell us about your reaction from that and what you might have learned about Nyloxin and how well it was received by your peers at that conference. So take it away.
Thank you. Okay, Steve, I guess you can hear me at this point, yes?
Yes, you're good.
Okay. Well, it's my pleasure to be here. Thank you for the opportunity. It's not that frequently that you find such a marvelous product that's available so readily. And it's our task to spread the word, educate, so to speak, the medical community that is in dire need of non-narcotic, NSAID pain relief methods. There was a great deal of skepticism on my part initially when I was introduced to Nyloxin, of course, and I used it on my painful right foot. I had sprained it, twisted it on a curb, like many of us do sometimes. And within 15, 20 minutes, there was a comfort. I would say the pain was relieved 90%, and it lasted for about a good 3 to 4 hours, and then a reapplication, and it continued on that way. I applied it about 4 times that day, 3 times the following day, twice the third day, and then thereafter I was fine. Evidently, the anti-inflammatory effect had allowed the entire healing process to be completed rather rapidly. It's a very simple, predictable product that works on a postsynaptic blocking of the acetylcholine receptor, and this is great for neuropathic pain and great for chronic and severe pain of arthritis, osteoarthritis, rheumatoid arthritis, even the pain of headache, sinusitis, and migraine. I have not had the opportunity to apply it to a person with migraine. However, I'm looking forward to that. I am quite delighted to be in a position to be part of the founding of this fine company to help promote a product that I feel is going to be extremely beneficial, not only to the medical community as an alternative to the rather toxic medicines that we use presently that impair people's cognition, start gastrointestinal bleeding and discomforts, injure elderly people's kidneys with NSAIDs. So this is a blessing, and I'm quite delighted to be part of it. I will do everything I can to participate and to assist in the education and presentation to other physicians and the medical community. And I just can't say enough good things about it, Steve. Anything else?
Well, tell us a little bit about your experience at the doctors' conference. You did the presentations. You were in front of a bunch of different doctors at that event. Tell us about it. How did it go? What was the reaction, and so forth?
Well, the first 2 days, they look at a 6'5" banner of my Nyloxin, and they look at it and they run into the conference and come back out. And we're still there by the banner, by the table with the product available. And about the middle of the second day, there was a lunch there was a lunch break, and I was behind a gentleman, Dr. Brochu, 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 and I was holding my dish, napkin, and utensils, and he was ahead of me. And he says, "Oh man, my left knee is really hurting. I've got to have it replaced, and it's really bothering me now." So I said, "Wait a minute." I got out of line, and I went over and got my gel bottle, and I said, "Here, put your hand out." He put his hand out. I gave him some gel in his hand. He rubbed it on his knee. By the time he got to the end of the table, he turns to me and says, "My knee feels better. My knee feels better." Now, he didn't have to say that. It just felt better. So about a half hour later, while I was in the conference, after dinner, after lunch, I texted him. I said, "Well, how's your knee now?" He says, "It feels great. Feels great." Now, like everything else, it will last in variable time periods of comfort, and he was comfortable probably for about 3 hours. And unfortunately, he didn't have any more to place on him, and I didn't see him again in the rest of the conference. So I'll have to contact him and get him a bottle of gel. So. And there was another gentleman that I know from here in Palm Beach County, Dr. Richard, who specializes in pain management, who was having some difficulty with a painful hip, applied some gel to his hip. He felt much improved, called me and told me that he felt much better and that he wants to have some of this product available to his patients. So it's a very encouraging, reproducible result that we're getting, just about more than 90% of the time. And Dr. Richardson has been applying it to many of his patients that have aches and pains, and he places a bit of the gel in their hand. They apply it to their shoulder, their knee, and 90% of the time there is comfort, relief, before their visit is over.
That's outstanding. That's excellent.
Yes, it is. Yeah, I'm very delighted about having such a predictable outcome each time. So right now, there's not enough nice things we could say about it. All we could say is let's get the word out and make the effort necessary to have as many folks as possible have this product in their hand.
That's absolutely right. Thank you so much for being involved in Nyloxin and on this call tonight. We really appreciate it. And I really appreciate the effort that you and Dr. Richardson made in Fort Myers to share our product at your doctor's conference there. We appreciate your efforts there very much. Look forward to having you back on a future call.
It was excellent. Okay, thanks.
Thank you. Ladies and gentlemen, we did work out an arrangement here to get Dr. Brad Eli back with us because he's been having some issues with the call-in on our webinar. Our webinar is full, according to the system anyway. It's the lines are tied up. So I've got Dr. Brad Eli here on my home line on my speakerphone, and I'm going to put my microphone up so that you can listen to him talk a bit about the opportunity here to be involved with Nyloxin. Now, some of you have heard Dr. Eli on previous webinars, and again, he's the founder and director of the San Diego Headache and Facial Pain Center. In fact, let me go to his screen here. I'm going to make sure I give a proper introduction here. He is a national recognized leader in sleep disorders treatment and pain management, postmaster's degree from UCLA with advanced training in sleep disorders. He is on hospital staff at Scripps Memorial Hospital, over 25 years experience in unique clinical didactic experience, and has also several inventions in the field of pain and sleep disorders. So, Dr. Eli, thanks. Welcome back to the webinar here, and tell us, some updates, some things that are happening with Nyloxin in your practice. And let me go ahead and put my microphone up. We'll do a quick sound check in the chat. So, Shelly, please let us know how his sound is coming in. Okay, Dr.
Testing 1, 2, 3. Testing 1, 2, 3. Everybody hear me? Okay, thanks, Steve. And it was great to hear Rick tonight. And I was glad to hear that you guys had a productive meeting in Texas. So, as many have heard, this is a interesting product that every provider, practitioner will pretty much approach it the same way, and that is, I've been in the pain field for 25 years. I've seen plenty of topical agents come and go, and most of them, if not all of them, make claims that are, good, and they do certainly cause a bit of improvement in patients. Cost of custom-made topicals these days for an amount equivalent to the amount that a person gets with a Nyloxin gel, like a regular or extra strength gel size, would run in the neighborhood of $1,000 custom compounded for pain. And again, anybody who's in the pain field knows how costly the topicals that actually do provide some level of improvement are very, very costly. Now, I was first introduced to this product by Dr. Ron Cook, our last speaker, and I can absolutely tell you without any reservation that I told Ron, I've seen a lot of topicals, and there is unlikely any way that this is going to be anything more than just another flash in the pan. And that was probably, 5 months ago now, and I now have used it on more than 300 people. This product is reliably successful in approximately 80% of the population that it's used on. I have used it in migraine headache patients. I've used it in trigeminal neuralgia patients. I've used it in arthralgia patients, and I've used it in myofascial or muscle pain patients. It will topically, in non-neurologic conditions, it will topically applied be effective within 20 minutes in more than 80% of the population. And if it's not effective within that period of time by at least greater than 50%, I haven't been impressed that it's going to work in that person. But when it works, it is remarkably effective, so much so that many patients will actually almost wonder, where their pain went. I don't know if anybody's keeping up with the pain field like I am being forced to do, but every narcotic analgesic, including Vicodin, has now been reclassified as a Schedule II narcotic, meaning that access to pain medication is going to become incredibly difficult for patients. I don't know if that's a nationwide thing or whether or not it's just a California thing, but no more calling in prescriptions, which means essentially that all patients will have to go to a doctor visit to get any kind of pain medication at all. I don't know if you guys have your finger on the pulse of, this field, but it seems like your product happens to be coming onto the marketplace exactly at the right time to fill in this gap. And I'm just glad that I was, what do I want to say, strong enough of character to listen to Dr. Cook and bury my opinion after trying it on 10 people. And now I can honestly tell you that I'm kind of surprised if it doesn't help a patient. I had a patient earlier this week, who was 2 weeks post-knee surgery, and her knee was nice and swollen, and she rated her pain level at a 6 out of 10, resting pain, just sitting in the chair. And so without telling her what it was, what it did, and how it worked, I put a little bit on her knee, and then approximately 15 or 20 minutes later, she was gladly reporting that she had 0 out of 10 pain, which typically, as a previous expert mentioned, usually lasts in the neighborhood of 3 to 4 hours. So people should expect kind of similar to a Tylenol or a pain medication at a 4-hour interval application. So, I don't know if I have ever been the head of the Glee Club. I don't know how to rah-rah too much, but if you knew me well, you would know that I don't rah-rah about very much of anything, and this is about as rah-rah as I can get. And I look forward to being involved in trying to get this product to the people who could very much use it, and that is the pain patients of our United States and the world.
Outstanding. And Dr. Eli, I know that you've been using the products in your practice for, you said, about 4 or 5 months now. Have you seen fairly consistent results, across the board? Do you have people that have used it a few months ago? Are they coming back and reporting in it they're still using it, or can you kind of give any review of how past performance, the consistency of it? I think you said already it's been pretty consistent, but maybe you can just touch on that real quick.
Sure. I would say that the measure of its success has been the fact that patients who I used to see reliably on a monthly basis because of their pain complaints and our ability to help their pain by providing either a medication regimen or some sort of non-Nyloxin product. I'm kind of thinking, because that's an interesting question that you're asking, and I can think of, right off the top of my head, 2 or 3 patients who I no longer see every month because they are using Nyloxin.
That's excellent. That's awesome. Well, Dr. Eli, thank you so much for taking time out of your busy schedule to be with us tonight. And as always, we've always enjoyed having you as a guest. We'd love to have you back again soon.
Sure. Thanks so much for having me.
Thank you. Okay, that was Dr. Brad Eli from San Diego, the Pain Management Center there. Ladies and gentlemen, we have one final guest speaker we're going to bring on tonight, and he is Dr. Ron Cook, retired orthodontist from the Phoenix, Arizona area. And let me go ahead and get to his bio here real quick. Okay, and Dr. Ron Cook got his chemistry degree in Arizona State University and his dental orthodontic training at St. Louis University. He's had extensive study on orofacial pain and sleep disorders. Following toward the end of his career in orthodontic dentistry, he did extensive research, and I'm guessing that's probably about the time frame where he made a connection with Dr. Eli, as Dr. Brett Eli just mentioned that he was introduced to our product through Dr. Cook. And presently has been retired for many years as an orthodontic dentist, but now working as a full-time Nyloxin MIE in our company as a Diamond founder. And put me on the computer audio. Okay, let's go ahead and turn it on for you. Make sure your green microphone is turned green and the red line is removed. But just one moment. Okay, ladies and gentlemen, we have Dr. Cook here on the speaker line as we did with Dr. Eli, but nevertheless, Dr. Cook, thanks for being on the webinar tonight. I know you've been with the company for some time, and you have spent a lot of hours researching Nyloxin, the product, the company, and so forth. And I know that you just spent a weekend down in Phoenix with your own event and trade show this past week, introducing the product to people from all over the country. So tell us your thoughts and tell us about how it's working for some of the people that you've recommended it to as well. So, ladies and gentlemen, Dr. Ron Cook.
Well, thank you, Steve. And yes, I did orthodontics for about a lot of years, but I've only been retired for really 1 year. So Nutrapharma Nyloxin and Myloxin basically came to me in February of this year. So it's been about 8 months of a wonderful Nyloxin journey, I would summarize. So for me personally, I had a history of a sore heel, a shoulder, and a pretty bad knee. I actually, in February, when I first came on board, I could hardly walk because of the pain in my right knee. So for me personally, I'm just letting you know that I had to use a crutch for a while. But once I used the Nyloxin on my knee, within about 30 minutes, that pain went away, and I've been pretty much pain-free in all of my joints since then. So, and I just use it as needed, right? So what I'm going to do tonight is share 3 powerful testimonies, right? So what I did today is I went around to some key people that I first approached with this Nyloxin product back in probably March or April, right? So it's been 5 or 6 months. So I'm going to go through 3 testimonials and do a follow-up more or less, right? This Nyloxin isn't a flash in the pan. This stuff works. So Nancy, my first person that I brought this to, Nancy had migraines since she was a teenager, and she was diagnosed as a migraine sufferer really her first year in college. Now, Nancy is about 50, so she's had a history of migraines for almost 40 years. So I gave her an oral spray sample about 5 months ago, and after about 2 weeks, the daily migraines, almost daily migraines were gone, okay? So that's pretty powerful. Now, if she goes to a higher altitude, the headaches tend to come back on, but she's just doing a Nyloxin maintenance dose once or twice daily, and she's very happy, okay? So that's the first one. Now, Sharon is my teammate, and she has a dry cleaning business, okay? So she's still a lot of people going in and out. Well, when I first brought this to Sharon, she says, well, Ron, you really got a snake oil deal going here now, right? But just to summarize for you, she now feels that Nyloxin is truly life-changing, and we've heard that quite a bit, right? But I will tell you, now I'm going to tell you why. So her symptoms, her original symptoms and medical conditions were that she had surgery on one foot and a broken ankle on the other. So basically, she had an arthritic situation in both feet and couldn't really walk on uneven ground. That's pretty bad, right? So when she would get through work, I was talking to her today, just really getting the whole story clearly, she would dread having to even go to her car. With each step, there was pain. Now, Tylenol worked, but she didn't like the side effects of that, okay? So she was even working behind the counter at her store, sitting in a wheelchair sometime because her feet hurt so much. And she also suffered a spiral fracture in her leg while she was trying to put on some tight jeans. So she had some challenges there. So for Sharon, when she started taking this Nyloxin, it took about 3 days for it to start working, and in about 3 weeks, there was no more pain. I have seen Sharon stand on a chair to help me put up a Nyloxin banner at an event and remark, I just couldn't have done that without Nyloxin helping me. So she took the oral spray 4 times daily when she started, 4 times daily as prescribed, and now does about 2 sprays daily. She just carries a spray bottle in her pocket. And another incident for Sharon was that she had a molar tooth extracted probably a month or 2 ago, and the dentist recommended Vicodin for the probable pain, which would follow since the tooth was very close to her sinus. Now, she told him that she did not need it and proceeded to have lunch afterwards with no pain because she had plenty of Nyloxin in her system and upped that dosage a little bit at that time. So that's pretty powerful. So she's had no headaches now for 5 months since using Nyloxin, and she senses that if they actually were occurring, that she wouldn't feel it. So that's pretty nice to just not have a headache. Now, when she went outside to do a yard work project a few months back, she wouldn't do that because of the next day aches and pains. So this time she shoveled several wheelbarrows full of dirt, etc., moving stuff around. And because of Nyloxin, she felt no pain the next day. Now, I've seen this quite a bit. It reduces next day aches and pains, amazingly, okay? So Sharon really likes the oral spray and calls it her top of my head to the tip of my toes therapy, which I think is pretty cool. She feels that she has an increased energy level and sleeps better at night. Now, previously, she would awake for an hour at night because of the pain in her feet. So to summarize, she has gone from the prospect of living a life of chronic pain to basically being pain-free. Sharon calls Nyloxin her everyday wow product and actively shares this product daily with her many customers. She's got about 100 of her dry cleaning clients on some form of Nyloxin. Now, right next to, I'm going to go on to the next testimony, right next to her little store there, she's got a cobbler named Aaron. Now, cobbler is not too many around anymore, but he basically works on shoes and leather. So rather than, I thought I was going to have to kind of gather his testimony, but what he had done was left Sharon his written testimony. So I'm going to read that. With your permission, I'm going to read it. I am a cancer patient. I have stage 3. I have stage 3 lymphatic cancer. I am prescribed a minimum of 27 different pills, pain pills that I take 3 times each day. As the cancer has progressed to this point, the doctors are trying to do as much as they can to make me comfortable. I have suffered through many operations and biopsies. My treatment started with a left breast mastectomy with a heavy lymph node scraping, and that was just the start. It has progressed to an inoperable brain tumor, which gives me terrible migraine-type headaches. I have also had a total right knee replacement. The way this cancer has spread, I now have small tumors all through my body, and because of this, I am forced to endure round after round of chemo and radiation therapy. I tell all of you this for this reason. When I first saw this Nyloxin, my first thought was, how can this work? How could something so simple do so much? I talked to Sharon, which is a dry cleaner owner, and looked into Nyloxin's origins and decided to try it. And wow, that's capital wow. It really works, and not just on some, but on all of my aches and pains. Now I still have to take certain pain pills, but have cut back on the heaviest ones. I use the oral spray in combination with a roll-on, and this way I can target the areas of pain directly. It works on everything: backaches, headaches, and all pains. I can go on, but the best thing I can do is suggest you try it. It really is a wonder drug and the best homeopathic natural pain-killing product on the market. My doctors can't believe the difference. I just tell them it's the Nyloxin, and they all agree that it truly works, and I'm the proof. So he summarizes, thank you. You have given me a more meaningful, pain-free life. I am so grateful. Thank you. And I would add, that's in his written handwritten testimony. I would add that several months ago, he told me about doing some outside yard work. His hands were really sore and swollen. His wife suggested using the Nyloxin gel, and they were amazed to see the pain and redness gone in a few hours. So Nyloxin really does have the ability to be life-changing. We've heard that several times tonight, and I think it's very powerful. It's not a cliche. It will improve the quality of daily living. We probably, in our area here, we probably have about 120 people who are using an Nyloxin product in our community here. This truly is the best pain relief product that few people know about. So we all need to continue to change that awareness, not only in this country, but around the world. So thank you, Steve, and I wish my computer would have hooked up, but sorry.
Wow, well, thank you, Dr. Cook. I appreciate that very much. And what a powerful testimonial to end our doctor's testimonial call tonight with. Amazing, and it's so touching to hear stories of how this product is literally changing people's quality of life, and it's a sad story when you have a terminal illness or cancer or something that is inoperable in that case. But to be able to give him a quality of life, in his days left, it's just it's an amazing thing. So, ladies and gentlemen, we've had a great call tonight. In spite of our minor technical issues, we've been able to get accomplished what we wanted to get accomplished tonight, and that was to have you get a little bit broader perspective of how Nyloxin is reaching out into the medical communities, and how people that are professionals in their various fields, from cardiology to dentistry, orthodontist dentistry to pain management, acupuncture, all these different areas and expertises, they all agree on the same thing, that Nyloxin works, that this is the product that's helping people. And folks, we're the only game in town. You're not going to find this product at Walmart, at Walgreens, at Target and Shopko, or anywhere else. You're only going to find it through a Nyloxin affiliate. We are the ones to bring this message of pain-free living out to the marketplace. Like Dr. Cook just said, it's the greatest kept secret that needs to be told. We need to tell everyone that we know about Nyloxin. And now we have a brand new product on top of this product that will do the same kind of thing for people with their companion animals, their dogs and cats. So folks, we have two grand slam products here to let the world know about. That is your opportunity. So if you're a guest on this webinar tonight, I highly encourage you to get back with the person that brought you here and get started right away with Nyloxin. And with that, folks, we're going to go ahead and wrap up our webinar. I want to thank all of our guest speakers, Mr. Rik Deitsch, Dr. David Talbot, for his testimony, even though he wasn't here to share it, but he'll be back with us again soon. Dr. Bill Richardson, Dr. Brad Eli, Dr. Victor Genchi, and Dr. Ron Cook. Thank you all for your participation on tonight's webinar. And ladies and gentlemen, that will wrap us up tonight. We will keep the chat open following the end of the recording for anyone's comments and questions, as we'll stay on for a few moments afterward. But this will officially bring our recording to an end. So thank you very much. And our next presentation will be next Tuesday night. So God bless everybody, and welcome aboard to Nyloxin.